Good evening, ladies and gentlemen. I think tonight I'm probably the only non-doctor addressing you, so I can't help Mr. Hamdan with this problem, but hopefully I can shed a bit of light on the Middle East pharmaceutical trends that we are witnessing over the last years and what are the forecasts coming over the next 5 years. Now you see here a lot of hospitals and clinics. Where I'm coming from is more on the pharmaceutical product side, with 15 years experience in executive management positions in the multinational pharmaceutical companies. And similar to Dr. Reem, about 1.5 years ago, we decided it was the right time to leave the corporate world and look really at what the Middle East opportunity is offering us in terms of market access to some of the innovative pharmaceutical products. So Genpharm has been in operation for about 1.5 years, and we're specialized only in the area of chronic disease, something like oncology, rare disease, genetic disease, and really the high specialty products which are considered low volume, high value. Now, I'll take you a few years back because we are attracting a lot of foreign companies to the Middle East. And when we start having discussions with them, when it comes to the Middle East in particular, the first concern is this the right time to invest because of the geopolitical risks? Should we open up our operations? Should we come to the region? And of course, this discussion has been going probably since before I was born, so nothing changes from that perspective. But they also have other concerns, the IP protection, the trade barriers, and also some of the cultural aspects that are not, let's say, well accepted or understood in other parts of the world. So this is the first discussion. We always have to set the level straight and make them understand that despite these difficulties, there is still a very large opportunity. And if you look today at how the opportunities are divided across the world spectrum, you have the mature markets, which are of course Europe, US, and what used to be called the developed world. And then you have some emerging markets, which are starting with the BRIC definition, but moving on to frontier markets, countries like Algeria in our region, Saudi Arabia, the UAE, and countries like Vietnam or Indonesia and the other part of the world, Argentina, Mexico, and Latin America. And these strategies differ a lot. Of course, if you're competing in a mature market, you would not have the same strategy if you were competing in an emerging market where market access and pricing become really the key to success. But they also have other concerns, the IP protection, the trade barriers, and also some of the cultural aspects that are not, let's say, well accepted or understood in other parts of the world. So this is the first discussion. We always have to set the level straight and make them understand that despite these difficulties, there is still a very large opportunity. And if you look today at how the opportunities are divided across the world spectrum, you have the mature markets, which are of course Europe, US, and what used to be called the developed world. And then you have some emerging markets, which are starting with the BRIC definition, but moving on to frontier markets, countries like Algeria in our region, Saudi Arabia, the UAE, and countries like Vietnam or Indonesia and the other part of the world, Argentina, Mexico, and Latin America. And these strategies differ a lot. Of course, if you're competing in a mature market, you would not have the same strategy if you were competing in an emerging market where market access and pricing become really the key to success. With better education, better knowledge, better market access, and reduced prices for some of the products that were off limit in lower GDP countries. So if you look at this map, you look at the Middle East, it's really one of the highest growing regions. Europe is growing at single digit. Japan is actually decreasing because of several factors. Some markets are moving more towards the generics, while other markets are still growing with innovative products. And the Middle East is really one of them, and that's why we chose to compete in that area. Now, I'm sure you have heard earlier Mr. Hamdan mention the injection of money going into healthcare, in infrastructure, clinic, but also in pharmaceutical product access. And then if you put that against what we call the risk and return ratio, as explained here by the Business Monitor International, the Middle East really presents very nice opportunities for investments. The return on investment actually is shorter in period of time than if you would do in the mature markets. And this has been understood by a lot of companies, and that's why you see a rush. Now, specifically to the Middle East, there are, of course, several factors that are showing or explaining this growth. First of all, we have a very young population. 300 million in people if you include North Africa. It's also an increasing population by 3%, and it's also a population that is aging somehow because you have a better access to healthcare. So similar to what we have seen in other parts of the world, you go into areas of, let's say, old age diseases more and more often now, where you see Alzheimer cases, Parkinson's cases, epilepsy cases, and some other diseases that usually are in a more advanced stage of life. You look at the education level, you look at the government programs that have been in place. You only need to open the newspaper in the UAE to read about diabetes, breast cancer, cardiovascular disease on a daily basis. A lot of the governments are spending huge amounts in terms of educating people about their diet, their style of life. And some of these diseases, of course, are mainly driven by lifestyle. Smokers are more prone to develop certain types of cancer. The diet is leading to a high rate of diabetes, and so on and so forth. So if you look at the overall percentage of growth coming from these markets, Saudi Arabia, due to its 27 or 28 million people, is always on the high end, followed by the UAE and some other markets. And nearby here, you have Iran with 80 million people that really presents a very large opportunity. This is again another way to look at it. The total pharmaceutical market today in the Middle East is at 32 billion, but it is expected to grow to 50 billion within the next few years. And that's really representing one of the highest growth worldwide. Now, if you look at which areas are growing, you have a lot of local manufacturers in the area that we have seen. In the early days, it was started more or less by Hikma, that you all have heard of, who has started out of Jordan, but now has become not only a regional player, but also an international player, having its products registered in the US and in Europe. Similarly, we see a lot of active players here in the region, in particular in Saudi Arabia and the UAE, using these markets as a platform to export into countries of Asia. The pharmaceutical market used to be a relationship between the company or the representative of the company and the doctor. Today, that is not enough. What you need is really to have the reimbursement authorities, the ministries of health, and so many other players involved. So the stakeholders that we need to manage have become really exponential in numbers. I'd like just to share with you one slide, which is not always really talked about here in the Middle East. And this is the prevalence or higher prevalence and incidence of some genetic diseases, as an example, thalassemia or some other genetic diseases. And this is driven by both environmental and cultural factors with a high number of consanguine marriages. The type of therapy, combination or monotherapy. And this becomes very interesting when you look at the genetic elements of the population. Then you really have to dig deep and understand that maybe what works in Europe does not really work on our populations. And there's a lot of research happening in that field, in particular in the Middle East as well, where we see over the last 2 years more clinical trials being developed, which wasn't really the case earlier. So it's no longer a market, but it's also a place where you can actually do research, and very interesting research looking at particular phenotypes and genetic disease areas. The healthcare sector or the pharmaceutical sector, as you all know, is one of the highest regulated areas. Everything is regulated from registration, approval, to pricing, to the way you manage the clinical trials, and to the number of years it takes you to develop a product from its day one until it hits the market, and that's usually 15 years in between, with a cost that is estimated today at $900 million. So the product that you see on the shelf life of the pharmacy, there's a good chance that it took 15 years in development, and it cost the company that did the research somewhere between $700 to $900 million. And a lot of people actually ignore this, and that's why the pharmaceutical sector has taken a lot of hit over the last few years. One final word on how we approach the market. Because it's a growing area, there isn't really a single approach to the market. What we have witnessed is a lot of joint ventures, a lot of mergers and acquisitions happening from countries that want to get access to the Middle East. So instead of coming themselves, they acquire existing platforms or existing manufacturing plants. There are co-promotion activities, co-marketing activities, and we have seen this in a very short period of time, that this business model that we are offering has really been attractive for foreign companies that want to get access to the 300 million in population. And again, it's all about deciding where do you want to play, because you can't be good in everything. So you have to choose your niche and the field where you want to play. Do you want to be a player that is in the generic field, or do you want to be a player that is in the hospital specialty area, and adopt your strategies accordingly? So this is where we decided to go based on everything I have told you. What we are looking at specifically is women's health, oncology, rare disease, and the neurology franchise. Thank you from my side. I hope it was enlightening and not too fast for you.